Hello colleagues, welcome to Mr. Kokosness's class. We are still dealing with IMCI. So this is main symptom number 5. That's what we're looking at. So if you're just joining us, try to go back to the introduction and main symptom number 1 so that you understand how we flow about IMCI. So again, just to remind you, go back to the general danger signs, you know what they mean, and what we call the main symptoms. So the main symptoms are the conditions or diseases that affect children. So we have 7 that we look at under IMCI for those children aged 2 months to 5 years. So that's what we have. So we are on number 5, which is acute malnutrition. That's what we are looking at today. So let's try and see what this is all about. So when you say acute malnutrition, what are we looking at? So what you're going to do is that under this we have to do the assessment as usual, and after assessment we are going to look at classification, which is you coming up with a diagnosis after you have assessed. After that you look at treatment, then you're going to provide the medication if there is a need of medication. After that, that's when you do counseling. After counseling, you do follow-up. So in counseling, just a reminder, we look at what the mother should be, or the caretaker, what should be doing, what they should be doing for the child, so that the child can improve. Okay. Then follow-up, which is the last one. This is just reviewed it. So we have 5 headings under the principles, which are assessment, okay, after assessment, classification, treatment, counseling, and follow-up. That's what we have. We have 5. So these you need to look out for them in the introduction. So now let's look at the assessment under malnutrition. So under malnutrition, you look and feel. So what are you going to look out for? So when you look for signs of acute malnutrition. And what are these? So these are 1. Edema, both feet. So this is very important because you're looking at acute malnutrition. Now, is this an emergency? Yes, it is an emergency because you're saying that there is acute malnutrition. So the word acute, it tells us that this is an emergency. So there should be edema both feet for you to say this is acute malnutrition. Okay. So after that, what do you have to determine? You're going to determine weight for height, stroke length under the Z score. Okay, that's what you're going to do. Then the third part you're going to touch is MUAC. So under MUAC, you're looking at mid upper arm circumference. So I'll show you the tape, the one we use for measuring MUAC. It's just below there. Okay. Then the measurements that we're going to follow are as follows. So let's try to see what we use. Weight for height, stroke length. So weight for height, stroke length, what should be the determinant? It has to be less than -3 Z score. Okay, so something less than -3 Z score, I will show you the Z score, or you have seen it on that under 5 card. So I'll show you how it looks, but obviously it's there on your under 5 card, you have seen it. But then it's if it's -3 Z score, then weight for height, stroke length, meaning that this is acute malnutrition. Or you do the mid upper arm circumference, I will show you as well in the image, which should be less than 115 millimeters. Then this is acute malnutrition. Okay, so then other things that we do are you check for any medical, okay, any medical complication. So any medical complication can be pneumonia or just any other infection the child might have. Then what about the general danger signs? You have to look out if the child has any general danger sign. As you know, the general danger signs: 1, convulsions now, or convulsions under this current illness, or unconsciousness, lethargy. So those are the general danger signs. But we have about 5 which we split. Check the first topic that we did. So a complication can be pneumonia, this here. So this is a medical complication, meaning that if a child has any of these, a medical complication, which can be pneumonia, or a general danger sign with malnutrition, or there's malnutrition, then the MEWAC is less than 115 millimeters, or weight for height length is less than -3, meaning that this is severe acute malnutrition. So you have to just check these. So that's what we have. Okay. Then other things that we need to do are that if there is no medical complication present, okay, if no medical complication present, then what we're going to do is that we're going to provide what we call RATIF, which is a ready-to-use therapeutic food for the child who is 6 months and or older. So if they are able to feed, then you provide RATIF, which is ready-to-use therapeutic feed. It's more like a peanut butter. That's how it looks. So if you provide this food, which looks like peanut butter, but you call it RATIF, so if they're able to finish, meaning that's good. But if unable or not able to finish a portion of RATIF, meaning that this child is also having acute malnutrition. Okay, that's what we have here. So if you look at this child who's smaller, this child, this is a child who's having malnutrition, but what are they lacking? They're lacking carbohydrates. Okay, so this should be marasmus because they're lacking carbohydrate. Then this child here who's edematous with the skin peeling off, as you can see, their feet and legs are swollen, and their arms. So this child is a child with kwashiorkor. Okay, so you have to go back to the lesson, just Google or try to search on my page where we're saying that SAM versus PEM, so that you see what that means. Okay, then here what we have is edema both feet. So if you have a child during your assessment with edema both feet, this means that the child is having severe acute malnutrition. So the child has been brought to you with acute malnutrition or malnutrition, then you come and assess. During your assessment, you see edema both feet. This is an indicator for severe acute malnutrition. Then there is what we call MEWAC, or mid upper arm circumference. So this is the tape that we use, as you can see. Okay, so it is in centimeters, but then even centimeters can be converted into millimeters. So if you measure, and after measuring you discover that the MEWAC, which is here, mid upper arm circumference, the tape shows you that the child is having less than 115 millimeters, meaning that this child is having severe acute malnutrition. Then another case should be when you look at the Z-score here. So the Z-score, which is there, this is found when you're under 5 clinic, this here. So if the child is having a Z-score less than -3, as you can see there is -3 there. Okay, if the child is having less than -3, meaning that this child is having severe acute malnutrition, which is there. Okay, so this is what we mean by Z-score, meaning I just try to compare their weight and their height. So that's why we do weight and height when you bring the child for under 5. So something less than -3 there, which is just below this portion here. Okay, meaning that the child is having severe acute malnutrition. Okay, so the gray there is for moderate, but the blue here is for severe acute malnutrition. So let's try to see how you can write it. So under your assessment, what you are doing is this: you're trying to assess all these. Those are the questions you're trying to ask, or you're trying to just see using your eyes. So mostly you see using your eyes, because here you can ask the mother some questions, but then most of the things you see, like for example edema both feet, you see by yourself and you grade. If it's both feet, then you are going to write that's under your assessment, look and feel. Okay, then weight for height, you are going to write for yourself to say, okay, weight for height length is less than -3 z-score, or MUAC less than 115 millimeters. Any one of these three, okay, any one of these is an indicator that the child is having severe acute malnutrition. Okay, then apart from these, now you can have maybe a child who's having a medical complication, so you can choose, okay, any of these medical complication, or unable to finish RATIF or ready to use therapeutic food, or breastfeeding problem. Any of these three plus the above, you can combine these and you can conclude to say the child is having these three, maybe not breastfeeding problem, not able to finish RATIF, or a medical problem, plus maybe those above. Then you can conclude to say that this child under your classification is having what we call complicated severe acute malnutrition. So these are the indicators for complicated severe malnutrition. So your classification will even be able to write to say that the child is having complicated severe acute malnutrition because the child is having edema both feet and the child is unable to finish RATIF. So you can just try to see what I've given you in the scenario and be able to assess, but you can write what you have assessed as well. Then after that, you are going to write the heading treatment and then be able to provide an antibiotic. So in this case, we are providing what we call amoxicillin, okay? So that's our appropriate antibiotic in IMCI, that's the one you give. So provide amoxicillin. Then another thing that you give, this is a malnutrition. You're going to treat and prevent, hypoglycemia. So you provide dextrose 50%. So dextrose, you can give it via IV, or you can give it via NG tube. So you can try to see which route is easier for you. If you can manage an IV access, you can give it, or via NG tube. Then keep the child warm because you're trying to prevent hypothermia already, because the child is severely malnourished. Then since this is a severe classification, you are going to refer the child urgently to the hospital. So this is what you do here, okay? So this is under severe acute malnutrition. So what about now when we say uncomplicated? Something uncomplicated. So under uncomplicated severe acute malnutrition, meaning that what we have is weight for height less than -3 z-score, yes, or there is something like or here, as you can see, meaning that the child is not having edema both feet, weight for height, MUAC, they've said or this, okay, MUAC less than 115 millimeters, then able to finish RATIF. So this child is able to finish RATIF, but is having weight for height less than -3, MUAC less than 115 millimeters, but then they're able to finish RATIF. That's the difference with complicated and uncomplicated. Okay, that's the thing. Then the child can be classified under uncomplicated severe malnutrition because you are able to see that the child is able to finish RATIF, but then they're having those problems. So this is uncomplicated severe acute malnutrition under your classification. Then you can continue by giving an antibiotic for 5 days because you're not taking this child to the hospital, you're just treating at the center. So you can give an antibiotic for 5 days. Then you can give or provide RATIF for those children above 6 months or more. Okay, then you can also do the counseling under the heading counseling. Then you can also assess for tuberculosis. So this will be your treatment under uncomplicated. And then there's another heading which we're saying that moderate acute malnutrition. So you keep writing, it's the same write-up, but then what you eliminate are some things. For example, here under moderate acute malnutrition, we're saying that weight for height between, now this is between -3 and -2, or MUAC 115 up to 125. So if you find that the child has been brought to you with malnutrition, but then the MUAC and weight for height are scoring such, what do you write under your classification? Are going to put moderate acute malnutrition. Then where do you take these children? You're going to assess for feeding and cancel the mothers. That's what you do. Okay. If feeding problem, they need to follow up for 7 days. Then assess for tuberculosis. Advise the mother when to come back to the hospital immediately. What should prompt them to come back to the hospital immediately? Maybe the child is beginning to swell up or beginning to fail to feed. Okay, then follow-up should be made in 30 days. That's what happens in moderate acute malnutrition. Then what about now the last part? The last part where we're saying that weight for height, okay, -2 Z-score or more. This is what we call no acute malnutrition, okay? Or MUAC 125 millimeters or more. Under your assessment, when you are doing your assessment, meaning that when you write the heading, a classification, you're going to indicate to say no acute malnutrition, because the Z-score -2 or more, or MUAC 125 or more, so that this gives you no acute malnutrition. Then what should be under your treatment? If the child is less than 2 years old, assess the child for feeding. So that's the thing here. That's feeding, and then cancel the mother on feeding. So that's what you do here. Okay, so this is what you do. Then this is just the instructions on the treatment for RATIF. Okay, let me just take it up there. So this is ready to use therapeutic food for severe malnutrition. Then what you do is give small regular meals and encourage the mother to encourage the child to eat often, which is 5 to 6 times per day. So they're just trying to give us extra information. Otherwise, this is what we do in IMCI and malnutrition. Okay, so just try to study harder and try to check out what you can do using this guide. So you can go to the question papers and see what you can write and how you can identify some of these things. So you've been with Mr. Coco. Try to just revise and also try to just go through the audio or video again so that you get the concept, and also start from the first part, which is introduction and main symptom number 1. So thank you very much for listening.